Well, 3 children are right now in ICU with COVID in New South Wales. They're among 2,000 children that doctors and nurses at Sydney Children's Hospital Network are caring for. Paediatrician and Director of Clinical Operations at Sydney Children's Hospital, Dr Joanne Ging, joins us now from Westmead Hospital in Sydney. Doctor, thanks for your time this morning. I know there's a baby and a child under 10 on a ventilator. I mean, this is pretty scary stuff, isn't it?
Good morning. At the Sydney Children's Hospitals Network, we have actually managed over 3,000 children with COVID-19 disease, and the majority of those children have been able to be managed in their home. And while we know that children in intensive care is very worrying for everyone, we're going to provide the best care we can for them and the other 2,000 children that we're currently caring for in our Virtual Kids program at home.
It must be pretty tough for frontline doctors and nurses to see a baby and a kid under 10 on a ventilator, I imagine.
So we manage children who get sick with viruses all the time, and some children do get sicker with viruses that occur in childhood. So we are very used to managing children who require this level of care.
So can you just give us a little bit of background on this? Are these children who have underlying health issues or were they quite healthy?
So we don't want to talk about specific cases today, but I can say that there are always some children who are more vulnerable to getting sicker with childhood viruses.
So, the 2,000 children then who are currently under your care, most of them are isolating at home. How does that work? How do you check in with them and see how they're going?
So, Ali, we have the most amazing team of doctors, nurses, social workers and allied health staff who are monitoring these 2,000 children at home. They either partner with the families to do teleconference or video conference to make sure that the children are progressing well. And if they're worried about them, we actually go out with our flying squads and with a doctor and a nurse, and we see them in their homes to assess whether they need any further assessment or treatment.
We have been warned that October will be the worst month for hospital admissions. Are you prepared for that?
So we have been increasing our capacity over the last few months from a service to Virtual Kids that we weren't running a few months ago. So we are absolutely certain that with all of the resources we have within the network, and we're going to partner with our paediatric teams all around the state, we will make sure that we have a capacity to care for all of the children in the state, not just children with COVID, but any other children who are sick.
Typically, how sick are kids getting with COVID?
So the majority of children who have COVID-19 either are asymptomatic and have no symptoms at all or have mild disease. They usually have a fever, a cough, a runny nose, a little bit of vomiting and diarrhoea, and sometimes they lose their sense of taste or smell. That's the majority of the children that we're caring for, and they get better within a few days.
OK, well, your doctors and nurses are doing a remarkable job. Thanks for joining us this morning. Karl.
More now on those terrifying figures out of Sydney, with 1 in 10 people who test positive to COVID ending up in hospital. Let's bring in former Deputy Chief Medical Officer Dr Nick Coatsworth, who is in Canberra for us this morning. Doctor, good morning. Nice to see your face this morning. These numbers are so worrying. New South Wales is still weeks from its peak. How is the system going to cope, do we think?
The numbers, Karl, sitting between about 5 to 10% nationally of people who are getting COVID-19 and getting hospitalised. And we have to brace for increasing numbers, that's true, but the hospital systems have had their surge plans now for the best part of 18 months. We know that we're going to have to care with COVID patients alongside people who don't have COVID-19 as well. We do have the intensive care capacity, of course. We've got about 2,700 staffed intensive care beds nationally when you add in the private hospitals. So, you know, I am confident. I know it's going to be hard. It's exhausting. I've just come off a shift myself over the weekend on the COVID wards. It's a very particular type of medicine, but I'm confident that we can manage the increased numbers.
Take us inside that ward if you can. What are you seeing in there in terms of cases and sort of severity of the cases?
I'm seeing a couple of things, Karl. I guess, look, from a purely medical point of view, it's not that difficult medicine, but we've learnt so much about the new treatments that we've got. We're using dexamethasone. We're using specialised drugs. One's called baricitinib to turn off the inflammatory response. We're actually asking patients, when they're conscious, to actually get on their belly and actually rotate every 2 hours, because that actually helps them breathe and makes them feel a lot better and potentially stops them going into ICU. And we've got a new drug called sotrovimab, which can be given to unvaccinated people who haven't had the opportunity to be vaccinated, which can help stop them from going to ICU and intensive care. But Karl, if I may, it's the social side of it that is so distressing. And this is why we need to get into our vulnerable communities and get them vaccinated. So we know that it's disproportionately affecting people from low socioeconomic status, migrant backgrounds, refugee backgrounds, homeless backgrounds. This is where we really need to focus our attention in the coming months.
So you must be concerned if this is only going to get worse over the next couple of weeks and where 1 in 10 are in hospital, if those numbers do surge, then surely the system is going to be placed under a huge amount of pressure.
Well, there's a balancing to be had here, and that is, of course, with the proportion of people who are vaccinated. I can tell you from our experience in the ACT, where we've got over 95% of people over the age of 70 vaccinated, that we're not seeing people in their 60s and 70s in hospital. We're not. We're seeing younger people who haven't had the opportunity to be vaccinated. So there will come a time, and that time will come in the coming weeks. We're going to hear the modelling figures today from New South Wales about when that effective vaccination will thoroughly kick in and the curve of hospitalisations will finally start to stabilise.
I think that'll be really interesting to see what happens with those figures today, with those forward projections. Meantime, in Queensland, the vaccination levels have fallen into last position. I mean, what on earth do you need to say to people in Queensland to get vaccinated, to get out there and to get it done?
I don't think it's any different in Queensland as the rest of Australia. This is a fundamentally human issue, that when the risk isn't in front of you, you don't tend to take action. When the risk is right in front of you, as it is in Sydney and Canberra and Melbourne now, suddenly you see these, you know, they're actually world-leading rates of vaccination in those states. So I would just plead with Queenslanders that it's just been lucky so far. Once the Delta variant gets into the Australian communities that are vulnerable, that have high-density living, it's almost impossible. Well, it's not almost impossible. It's impossible to stop, and the only thing you can do is vaccinate.
Nick, always good to talk to you. Thanks so much for being with us. Appreciate it.
Thanks, Karl.
Okay, Ali.